Hi, I'm Danny Legal. I'm one of the pharmacists in ambulatory care at Reedsburg Area Medical Center. We currently have 4 pharmacists rotating through our ambulatory care services for a total of about 2 FTEs, and we are completely embedded in the clinic, so we have an office right in primary care. Most of our work right now is in diabetes education. We have one of our pharmacists who is CDCES certified, and the rest of the pharmacists are also working toward that certification. We receive referrals from our providers, and diabetes education is essentially seeing the patient, making sure they understand their disease state, making sure they understand their medications, and also lifestyle strategies to help them manage their diabetes a little bit better. We see patients ranging from prediabetes to type 2 diabetes. We're looking to see more patients with type 1 diabetes on insulin pumps, and we also see those who have gestational diabetes. We are able to order labs and diabetes-specific supplies through a collaborative practice agreement. And we also work as a team with our nurse practitioner who's focused in diabetes education. We meet on a weekly basis as a team to discuss patient cases and also anything else that's up and coming and interesting for the week. We're also working to start a new service in our ambulatory care program, which is chronic care management. This is one program that was started by our past residents, and we are now taking over that service as a pharmacy team. So chronic care management is where you're basically seeing patients who have 2 or more chronic conditions and helping them to manage their disease states. So right now, we are focusing on patients who have polypharmacy, helping them to manage their multiple medications and disease states, and we're able to bill Medicare or some commercial insurances if we spend 20 minutes or more doing so. Like I said, we're just starting out with this service, so we're excited about where this may lead, and we're working to recruit more patients. We are also working on utilizing outcomes more on the clinic side to act on tips and provide comprehensive medication reviews to help the clinic improve their star ratings and help patients to maintain their adherence to medications.
My name is Brian Schobert. I'm an ambulatory care pharmacist here at Reedsburg Area Medical Center. So along with diabetes and diabetes education and chronic care management, some other student experiences that we've had is shadowing our diabetes-focused advanced practice nurse practitioner while she sees patients either in family medicine or for diabetes in specific. We have a 340B program here at Reedsburg Area Medical Center, and our lead pharmacist has a lot of experience there, so we can definitely do a lot of education and show the ins and outs of running a 340B program. Students have also done monthly wellness presentations. We have a senior center called the Fuchs Center right near the hospital, and we have students create and present on a variety of health topics to seniors there. And then we also do some long-term care consulting, so if students were interested in that for long-term care facilities, either skilled nursing or assisted living. Some future opportunities we're looking forward to starting here, hopefully before students even begin on rotation in May, is integrating with our current anti-coag clinic so that we have pharmacists embedded in that clinic as well. Right now it's nurse-driven, and pharmacists could assist with trouble warfarin patients or bridging and other things like that. We're also looking to create a CPA for management of diabetes medications in our diabetes education clinic, and expanding our chronic care program so that it's more specific disease states, maybe focused on things like heart failure, smoking cessation, weight loss, etc. The expectations we have of students here is they will basically be treated as an ambulatory care pharmacist in training, where you will be seeing with a preceptor, working up patients prior to clinic, seeing patients in clinic, writing the notes, writing recommendations, and following up with these patients as well. We have a lot of interprofessional collaboration, so talking to doctors, getting recommendations to them on the fly sometimes even. Students will work on a small project that's either focused on an ambulatory care setting that we're already working in or public health. We do have 2 PGY1 residencies on site, and students have done a lot of work with our residents. Students have the option to present to pharmacists, providers, nurses on a variety of projects. So some expectations of students in the ambulatory care rotation are that we will basically treat them as a new ambulatory care pharmacist in training. They'll be working up patients prior to clinic, seeing patients in the clinic, writing notes, sending recommendations to providers, and then following up with those patients. We do a lot of interprofessional collaboration in the clinic, so a doctor will pop into the office and we'll have to talk to them about recommendations. Students will be working on a small project, either focused on ambulatory care activities or a public health project. We do have 2 PGY1 residents on site, and students have collaborated with them on a variety of projects before too. Students have the option to present to pharmacists, providers, and nurses on a variety of health topics, including immunizations, new drugs, new guideline updates, etc. Students also complete a journal club, other topic discussions, or other opportunities as we see fit for either students and pharmacists to continue learning. A typical schedule for our APPE students is we want to make sure that they have project time to work every week, so we usually set aside one day to work on projects and outcomes. So Monday, right now, we have diabetes education. Tuesday is a project day and outcomes day. Wednesday is diabetes education. Thursday is chronic care management. Friday is diabetes education. And we're hoping as we grow our chronic care management program that we will flip one of those diabetes days to a CCM day as well. Our hours of operation is 7:30 to 5:30. We usually start seeing patients at 8 in the morning and our last appointment around 4 or 4:30 in the evening. If we don't fill up with our APPE required slots for ambulatory care, we will open to other elective rotations as well. We look forward to seeing you here at Reedsburg Area Medical Center Ambulatory Care Pharmacy Rotation. Thank you.